Networking often brings with it a real sense of discomfort, evoking images of cringy, awkward conversations and forced interactions. But networking is really just about creating or building intentional professional relationships. And these relationships play a really important part of growing a private therapy practice. So, in this video, I'm going to share with you the main benefits of creating and nurturing these professional relationships and also talk you through the five main types of referrer relationships and referrer activities that you should be focusing on as a private therapy practice owner. So, the benefits of developing these professional relationships. So, firstly, obviously, referrals. So, more referrals means more clients, and that obviously helps you grow your therapy practice. Number two, it's when you create a trusted network of health professionals, it's actually a real benefit, not just for you, but for your clients as well. Because if you're nurturing relationships with health professionals that sit outside mental health, but also see your ideal client, it means that if your client does need some help with something that sits outside your space, you have some trusted professionals that you can refer to. It's great to be able to just bounce ideas off each other, whether that's clinical or non clinical, and just have a network that can provide you extra support. So, especially if you're a solo practice owner, it can be a lonely world if you're a solo practice owner or business owner. There's so many balls to juggle and hats to wear, and it can be really stressful at times as well. And it's one of those things that no one will ever really understand or get it apart from someone who's going through a very similar situation. So if you've got relationships with other solo practice owners, it's just that support that you can brainstorm together and support each other as you're growing your practices. Another benefit is being able to create joint content together. So over time, when you develop these relationships, you'll come across people and go, right, actually, we're really aligned, really complement each other. Why don't we write some joint blog articles together? We could do a podcast together, create some video discussions together. So that's just ways of supporting each other, but also really helping to grow each other's practices as well. So there are five main referrer relationships or referrer activities that you should ideally be focusing on to grow your therapy practice. And so I'm going to talk through these five now in detail, and it may not be possible to do all of them at once or at least start all of them at the same time. But towards the end, I'll also share what I believe are the priorities for you to do if you can't do everything. So, number one is developing relationships with mental health professionals who specialize in different areas than you. So, set yourself a goal of developing relationships with 8 therapists who look after different niches or different areas, and find them on either Googling or Psychology Today or just other referrer platforms. So ideally, you're looking for these therapists in your local community. So you may see online clients or do telehealth across the state or across the country. But I always think it's nicer to connect with people more locally. It just adds another element that you can relate to. Someone who lives near you just gets things around where you live. And it also means that you can potentially catch up in person as well, which is obviously a really nice element of developing a relationship. So, put a list of these together, and then the first step is to reach out to them. And this can just be a simple email. So, as simple as, hi, first name, my name's X, and share a little bit about you, what you specialize in, with your approach, a bit about your practice. And then say something like, I just came across your profile and I felt like we were really aligned. And I just thought I might reach out to see if you're interested in meeting or catching up to see if there's possible ways of working together and cross refer. Look forward to hearing from you. And so you will get some replies to them. Not everyone is going to reply, and that's totally okay. But for the people that do reply, I suggest the first thing is probably like a Zoom chat, maybe a phone call or a Zoom chat, just because this first meeting is sort of like a first date, just sort of just sussing each other out, making sure you click and connect, and it's going to be something that's worth nurturing. And so if that relationship is worth nurturing, then your task is to nurture that relationship. So really be proactive in developing that relationship, because instead of relying on them to come to you, if you're controlling that relationship is just going to develop a lot quicker. So set up a spreadsheet or set up some reminder that prompts you about every 2 months to reconnect with that person. So that could be to go for a walk, take them out for coffee, refer them a client, catch up to discuss some research that you came across, share an article with them that you think they might be interested in. There might be an event that comes up, a clinical event that you think they might be interested in that you can go to together. So always thinking about these interactions, they are social in nature, but always think about them from a clinical lens because after all, these are professional relationships and you're developing them so that you can help each other grow your practices. So, number 2 is developing relationships with mental health professionals who specialize in a similar area to you, but who are much more established and busy. And so, when we're thinking about mental health professionals who specialize in different areas, that's where there's a really great opportunity to refer people who aren't the right fit for you and vice versa. But when we're thinking about mental health professionals who specialize in the same area, it's really thinking about mental health professionals who are much more along their journey than you are. So they've built really established, busy practices. And because of this, they're getting people contact them and they're just at capacity. So these people either go onto a wait list or they have to be turned away. So aim for around 2 to 3 therapists in your local community, so similar to those other mental health professionals, ideally locally, so you can potentially catch up in person. And so put a list of a number of them together, maybe 5, just because some of them won't reply. And so reach out to them and similar to the other mental health professionals, just suggest that you catch up for an initial meeting to discuss potential ways to work together. And so these busy clinicians can really find it so helpful to have therapists that they really trust that they can refer to. Because it means that if they get clients contacting them, that they don't either have to put them on a wait list or turn them away. They can actually refer them on to someone that they know they can trust and will provide an amazing service. So, number 3 is developing relationships with health professionals who aren't mental health professionals, but who also see your ideal clients. So, depending on what type of therapist you are, it could be pediatricians if you look after children and teens. It could be gynecologists if you look after women. Obviously, there's then practitioners like GPs or primary care physicians, naturopaths, nutritionists, dietitians. And so the idea is to build relationships with these people that you can then cross refer. Because let's say you see children, there will probably be times where you might be chatting with their parents and they're looking for a pediatrician that you can then recommend. And vice versa, pediatricians will be seeing parents and a conversation will come up around their child's mental health. And so if they have that trusted relationship with you, then they're going to refer that parent and that child onto you. So it's also important to think about the health professionals that will actually have time to have a relationship around someone's emotional well-being or time to at least check in. So if you're thinking about a health professional such as like a chiropractor or physio, they often have a number of rooms going, they have short appointments, and so they're sort of whipping through people. And so there's not a lot of opportunity to check in and have a longer conversation. So think about, especially allied health, who has that extra time? And so typically appointments are longer when you're thinking about, say, a nutritionist or naturopath. It's also important to think about the best way to initially get in front of them. So I always say if you can't get an email in that person's inbox, then it's probably better to think of a different strategy, which might be popping in. So if you're reaching out to, say, a solo naturopath or a solo therapist, then it's quite easy to get their email and send them an email directly. If you're reaching out to a specialist like a pediatrician or a gynecologist, or to like a GP or primary care physician, then obviously it's difficult, if not impossible, to get into that doctor's inbox. And so sometimes it's better to literally just pop into the practice. So you can just pop a cover letter together, maybe take some flyers or brochures if you've got them. Just pop in, introduce yourself to the practice manager, and just see if that doctor would be willing to have a conversation or a meeting with you. And with things like that, so GPs and specialists, but particularly, I guess, GPs, you can also offer to do some training for their doctors as well. So it just adds a lot more benefit for them in starting to create that relationship with you. So the 4th referrer activity is joining established peer groups. So, especially if you're in the early days of growing your practice and you're a solo practice owner, having that extra support just is so important. And so, research in your local area to see if there's any already established peer support groups. So, I know in the States, I've actually come across some state, say, social work and counseling associations that actually advertise that they have peer support groups that you can join. But if not, join some Facebook groups that focus on therapists and just ask the question in the group to see if that group has already been established. And if it hasn't, there is also opportunity for you to set that one up as well. But it just means by joining one of those peer support groups, it means it's obviously really beneficial, provides that emotional support to you. It enables you to bounce ideas off each other clinically, learn from each other, but also around managing your practice. But in terms of growing your practice, that means that you're developing relationships with other therapists. And of course, some will specialize in other areas and some may specialize in similar areas, but it just opens up more referral relationships and pathways that you can start referring back and forth to each other within the group. Number 5 is establishing your own peer group or case study group. So, this is not just therapists, but this is thinking about a mix of health professionals. So it's really multidisciplinary, if I can say that word. And so think about, for example, say you were a therapist who looks after children and teens. So if you put a case study group together, which consisted of, say, a couple of other mental health professionals, a pediatrician, or maybe a couple of pediatricians, some GPs or primary care physicians from different really busy practices, maybe a nutritionist or dietitian that specializes in working with children and teens. So imagine bringing that group together and thinking about that you're bringing case studies or examples along. And so you're discussing these case studies, you're sharing your ideas and how you would address these issues through your different expertise and different lenses. And so you're just learning from each other, you're building trust over time. And so you can see over time that it creates such a great group where you can really start to see the referrals flow back and forth from each other in developing these referral relationships and creating these activities. It will really pay off in the long run. It certainly requires time initially because it takes obviously time to build relationships, especially that you really trust clinically. And there is, of course, that lag. So you could see someone and they're like, oh, wow, you're amazing. And they see a client who's the perfect fit for you. They have to obviously remember to suggest you. That client has to decide, yes, I think that's probably a good idea, but then they have to remember to book an appointment with you, and then they do have to book an appointment with you. So you can see there's a lot of different things that need to fall into place. But the more work you do, once that lag has been reached, it starts to build momentum and it really adds such a great solid pathway of extra clients into your practice. And so, as I mentioned in the beginning, obviously you may not be able to do all of these, especially if it's just you or you're in a really small practice. And so the ones that I think get the greatest return on investment initially or greatest return on effort initially is really the mental health professionals and probably the primary care physicians as well, or GPs. So I would focus on building relationships with maybe not 8 initially, but just break it down to maybe 3 to 5 of those mental health professionals who specialize different areas, and then maybe 1 to 2 really established practitioners who specialize in a similar area, and then look for a couple of really established primary care physician or GP practices in your local area. And so start with them, and then once those relationships start developing and nurturing and you start to see more clients come in, then over time, then you can start adding in some more referrers and some different activities into the mix.